Mr. Smith. How are you? My name is April Brown. I'm a student pharmacist here at In-N-Out Pharmacy, and part of our rotations are to practice taking physical assessments, and I know you're going to see the pharmacist in a bit here, but if it's okay with you, I'd like to I'm going to take a measurement of 4 different things, and it'll take about 10 minutes.
Okay.
Is that all right?
Sounds good.
Okay, cool. Let me just wash my hands here, and we'll get started. First thing I'm going to do, I'm going to take 4 measurements. I'm going to take your temperature, I'm going to take your pulse rate, your respiratory rate, and then your BMI to measure your fat, okay? So the first thing, we're going to take your temperature. You lift your tongue and place this right underneath. In just about 30 seconds here. All right, let's see. Perfect. You're at 97.8 degrees Fahrenheit, and that's right at 36.6 degrees Celsius.
Okay.
Normal range. Okay. The next thing I'm going to do is I'm going to take your pulse. I'm going to measure on your, well, I can go on the right side here. And here, let me get this. And again, that's going to be 30 seconds. And I'm just going to measure here. So. Perfect. Okay. You're right at 56 beats per minute, and again, that's the normal range. While I took your temperature, I also counted your respirations. We tend to try to distract you while taking that so that you don't start kind of sync your breathing with my counting. But you were at 16 respirations per minute. Again, normal range. Now, let me take your, I'm going to take your weight and your height. Okay. If you want to go ahead and stand here. And I'm going to need you to actually remove your shoes.
Oh, okay.
Just so that we can get the most accurate reading we can get. All right. Okay. Let's see here. That's perfect. Don't mind my clipboard there. All right, that puts you right at 68 inches. That's fine, you can step down, which is 173 centimeters. And I have in the chart here that your last weigh was 165 pounds. Yes. Is that accurate?
Yes, that's correct.
Okay. How long ago was that about?
That was, I weigh myself every week, and the last time I weighed myself, it was about 165.
Okay, perfect. Okay, and that comes up to 75 kilos. Okay, and let me do the calculation really quickly here. And that puts your BMI, which is the body mass index, at 25. You're right on the border of normal and overweight. Clearly, I can look at you and see that you're not overweight here. It says in the chart that you get regular exercise, basketball. And so because the BMI is just an average of your body fat, what we like to do is actually measure the percentage of body fat. And so I'm going to do 2 more tests really quickly, and that'll give us a more accurate reading of your percent body fat. Okay. That's okay with you? Yeah. All right. So the first thing is called elbow breath. I'm just going to measure. If you want to stand here and copy after me here. Alrighty. Perfect. Yeah. There you go. And I'm just going to place this little grabber here. Right between your elbow bones here. Okay. Perfect. That's right at 6.8 centimeters, which calculates to a medium frame as anticipated. And then I'm going to do 1 more reading, and that's called a skin fold thickness. So if you don't mind, I can raise your, okay, that'd be perfect. And what I'm going to do is I'm just going to measure from your shoulder blade to your elbow. I'm going to take a medium marker for that. Here. And then what I'm going to do is just, oh, pardon me.
Oh, no problem.
I'm just going to grab your skin here.
All
and I'm
right.
going to take 3 because we like to get an average.
Okay.
That's perfect. And one more time here, just for good measure. Perfect. So that puts you right at 13 millimeters, which is 19.3%. Again, normal range. The chart said you were 26 years old?
Yes.
Okay, so again, normal range for a 26-year-old male. Everything looks great. You're in good health, Mr. Smith. The pharmacist will be right in to see you, and I do appreciate you allowing me to take your
of course.
signs.
Thank you.
Have a good one, okay?
All right, you too.
Bye-bye.
Thank you.